Atrioventricular block and bradyarrhythmia are common following tricuspid valve operations, owing to the valve's proximity to the cardiac conduction system. This study investigated the rates and associated risk factors of permanent pacemaker placement to treat such complications. Using the Society of Thoracic Surgeons Adult Cardiac Surgery database, the authors retrospectively analyzed data from a total of 71,937 patients who underwent tricuspid valve operations in the United States between 2011 and 2020. The percentage of patients who required postoperative pacemaker placements remained quite stable over the study period, at approximately 15%, although the proportion of tricuspid valve replacements increased significantly, from 10% in 2011 to 17% in 2020. The overall incidence of postoperative pacemaker placement was 13% after tricuspid repair and 25% after tricuspid replacement. Among patients undergoing isolated tricuspid operations, this incidence was 4% for repair and 24% for replacement. The median length of hospital stay was significantly longer in the patients who required postoperative pacemaker placement compared to those who did not. Multivariable regression analysis identified several independent risk factors for postoperative pacemaker placement, including preoperative patient characteristics, older age, female sex, hypertension, non-AF arrhythmia history, congestive heart failure, and endocarditis, concomitant operations, longer cardiopulmonary bypass time, tricuspid replacement, and lower hospital and surgeon tricuspid operative volumes. In summary, the risk of damage to cardiac conduction tissue requiring the implantation of a permanent pacemaker following tricuspid valve operations is 15% in the U.S. This risk decreases at centers and with surgeons who perform higher volumes of such procedures. Innovations are warranted to address this significant morbidity.